Thank you all very much. I'm sorry I've got to hit and run. I think I've got about 10 minutes to talk to you this morning or this afternoon. But I have a beloved grandson who's playing soccer at 3 in Newton, and I haven't seen him play soccer yet, so I promised him I'd be there today. Anyway, it's great to be with you, all of you. And I think I've just got a few minutes to talk about a very easy issue these days, which is how do you get things done in a very polarized political environment? That's my topic. See if I can do it justice in 10 minutes. And first, I think probably it's a good idea to think back a little bit. I'm a great student of history. I never read fiction because I think the real thing is a lot more interesting. And when you're as old as I am, this isn't the first time, folks, that we've gone through a period of political polarization. Somebody said to me not too long ago, "You haven't seen it so bad." I said, "Did you see the movie Lincoln?" I mean, that was bad. That was bad. I was around during the McCarthy period. That was bad. I was inducted in the United States Army, and 3 days later I had to pass for a personnel interview, and the guy had a file on me with every single political activity I had ever engaged in at Swarthmore College. What do you think of that? Where do you think that they got that information? It took us about 10 years to find out. The FBI had a tap on the Swarthmore switchboard and was recording every single phone call that went through that switchboard and taking notes about guys like me and the political activity. And Vietnam was far worse than this. So we've gone through these periods, and the question is, how do you get things done in an atmosphere like this? It took me a long time, folks, to figure out how to try to do it. Because when I first went into the Massachusetts legislature, I was a pretty good talker. I was not a very good listener. I wasn't a very good consensus builder. I was walking into a government that was one of the 3 or 4 most corrupt state governments in the country at the time. And we had a lot to do to straighten it out and at the same time see if we could get things done. And it wasn't until I was elected and then defeated for re-election the first time that I started waking up to the fact that if you want to get things done, you've got to be a good consensus builder. What do I mean by that? You've got to be somebody who understands that in this world of ours, bringing people together, finding common ground, and then looking for solutions is the way you get things done. And let me give you one example of that, and that is this whole debate over health care. If you went out and took a poll tomorrow in the United States of America and said to the American people, should working Americans and their families have decent, affordable health care? And 80 to 85% of the uninsured people in this country are working folks, not sitting around, they're not loafing, they're not on public assistance. If you're on welfare, you know, you get Medicaid. These are working Americans without health care, without health insurance. What do you think the numbers would look like if you went out and took a poll like that? What do you think? 93% of the American people say that working Americans and their families should have decent, affordable health care. I mean, it's overwhelming. So how come we're divided on this issue? How come we can't do what every other advanced industrialized nation in the world has done, and that is to provide decent, affordable health care for all of its people? And in order to do that, you've got to bring people together. You can't be a divider. I don't want to talk about the current occupant of the White House, but he's not a consensus builder. He's not the only one. You've got to bring people together. You've got to have serious discussions about the problem. And of course, what you'll find if you bring people together around an issue like health care is that there's overwhelming agreement that, in point of fact, collectively we should be providing good health care for all Americans at a reasonable cost. And that's something we can do. I think, too, it's important that in putting that process together, you help people to understand that this isn't another welfare program. This is not another welfare program. This is an effort to make it possible for working Americans and their families to have the kind of life that I think all of us think Americans should be able to enjoy. And of course, if we don't do that, then the folks that aren't insured end up in the emergency room at 3 or 4 or 5 times the cost of going to the doctor's office. And who do you think pays that? We all do, because our insurance premiums go up to pay for the free care in the emergency room. These folks show up. And that's not the place to get primary care. So my hope is, I'm not sure it'll happen during this administration, but my hope is that these lessons that I learned, believe me, painfully, about how you bring folks together, how you have a discussion, how you build consensus, how you begin, once you have the vast majority of people agreeing on what the problem is, you're halfway to a solution. At least that's been my experience. And then the question is, okay, so how do we do this? And there are lots of ways to do it. There's not a single way. There are a variety of ways. These days in this country, we have a variety of answers to this. I mean, if you want a government program, you've got the VA. And on the whole, despite some of the VA's problems, the VA provides very good health care to the people who are eligible for that. For those of us 65 and older, we've got Medicaid. It's a terrific system, folks. It's a terrific system. And all of you, thank you, are paying for it by a deduction from your paycheck. It's not much, but it's something. And it makes it possible for folks 65 and older in this country to enjoy really excellent health care and the security of knowing that you're going to be able to have it. We have Medicaid, which has been expanding, as you know. Also, a combination of state and federal funds. But why do we have 30, 40 million people out there, many of whom now do have insurance, thanks to the Affordable Care Act, but with folks out there who seem to want to take it away from them? And I just don't understand this. Could we have a better system? Yeah. Should it be universal Medicare? I think so, but there are other ways to do it. Germany, for example, has an excellent health care system. It's not a single-payer system. There are 150, 200 nonprofit insurers in Germany who provide health care. But they provide excellent health care, and they do so at half the cost we're paying in this country. Why? Because we have a system that's loaded with administrative overhead and all kinds of stuff that is totally unnecessary. So whether you like single-payer or you like multi-payer, the fact of the matter is that you can have either, and you can do so in a way that provides good, affordable care for everybody. And imagine what that would be like if everybody in this country had basic health security. So consensus building is an important thing. Many of the issues that we face these days have very broad public support. The challenge for those of us in politics, the challenge for people in political leadership, is not to divide but to try to unite. As I say, this was a painful lesson that I learned only over an extended period of time. But once I figured it out, and I teach this now to students at Northeastern University and at UCLA, how do you build consensus? How do you come up with solutions? Once I figured it out, it really wasn't that difficult. Bring people together, opponents and supporters, whatever it is that is going on, sit folks down, have good staff if you're a governor or president or whatever who can work effectively with people. And you'd be surprised at the results. I just want to tell you one quick story before I wrap up to give you some example of this. We had some serious crime problems when I first became governor. I'm very proud of the fact that today Massachusetts has the lowest homicide rate in the United States of America. We also have very tough gun control, and there's a relationship between controlling guns and people getting shot. But it was bad. And my lieutenant governor was a guy named John Kerry, who had been the first assistant district attorney in Middlesex County at a time when the law enforcement community was all over the place and we really weren't doing well. And he came to me after we got elected and said, look, you should create a governor's anti-crime council. You be the chair, I'll be the vice chair. Let's bring folks in the law enforcement community together, and let's see if we can't end this constant conflict and really get serious about law enforcement. And we did that. And we also added a few selected citizens, non-professionals in the field, including the general counsel of the Massachusetts Civil Liberties Union, who subsequently became a great federal district court judge. We began to have meetings on a monthly basis. I think it was every Wednesday. We spent a half a day. I chaired, Kerry vice chaired, no substitutions. And all of the key folks in the law enforcement community, along with folks like the then general counsel. Now, she had spent a lot of her time suing police officers on civil liberties grounds. A year after we began this, she came up to me one day and she said, "I'm getting worried." She said, "I'm starting to like these guys." I said, "I'm not surprised. They're very good people. They're in law enforcement, but they also believe in the Constitution and the Bill of Rights. And I'm not surprised at all." We never had to take a vote, the Governor's Anti-Crime Council. We always did things by consensus. And she went on to become a federal district court judge, a great one. So these kinds of things are possible, folks. But we need people in public life and in public office who understand the importance of bringing folks together, and I can't imagine a better time to try to do that than now. I don't know about the rest of you, but I'm very troubled about this constant conflict that we're facing all the time. I mean, that's not governing effectively. If you're going to govern effectively, you've got to be able to bring people together. You've got to be a good listener. I wasn't a very good listener when I started in politics. I was a pretty good talker, but a good listener. And I came to the conclusion that, for one thing, listening is less tiring than talking. And secondly, you learn things. So being a good listener, being somebody who really can find consensus among a lot of people who maybe come to the process feeling as if, they're on opposite sides. It's amazing how, in so many cases, not all, but in so many cases, you really can make a difference. So that's my message for today, and I'm off to a soccer game to watch Peter Dukakis play soccer. Thank you very much.